Hello, everyone. I'm Dr. Nina, Director of TOVA Community Health, back for another TOVA Tuesday episode. I want to share with you, I have a great guest today, Miss Nurse Wendy, who is the Chronic Care Management Program Coordinator at Family Medicine at Greenhill, and she's also the Nursing Supervisor. Wendy wears many hats and is so super talented in so many areas. But today we're going to talk about the importance of having a nurse on your team and about care coordination. So I want to invite Nurse Wendy to TOVA Tuesday today. How are you?
Excellent. Thank you, Nina. How are you?
I'm doing great. We're both nurses. Our background is in nursing, and we, come from so many, we wear multiple hats in so many areas. Absolutely. But I was just so impressed, Nurse Wendy, about your background, and just wanted to share with the audience, like, what made you become a nurse and want to serve the community in so many ways that you do.
Well, I have to tell you, I always wanted to be a nurse ever since I was a little girl. My mother was a nurse, my father a doctor, and wow. I just always drawn to my mother talking about her experiences in nursing training and as a nurse. And I toyed with medicine, but then in my young mind, I decided that being a nurse would really fit in well if I wanted to fulfill another dream of mine, which was be a stay-at-home mom if I were lucky enough to get married and have children. And I felt that nursing was a career I could leave and then come back to and jump right back in. And indeed, that is what happened in my life. And I never regretted it 1 minute. Not only did it fit in well with the family model, but it was a profession that I loved from day one and still do, actually.
That's great, Nurse Wendy. And I just want to say, your educational background is impressive, going to Georgetown University, getting your Bachelor's of Science in Nursing and your Master's at Columbia University, but also that you have such dimensions as well in your expertise as a certified hypnotherapist, specializing in smoking cessation. How did you get into that? And are you currently doing that and offering that at the practice?
Okay, so I have a cousin who is a certified hypnotherapist who teaches people, trains other people. And I was always fascinated by her profession. And I was really drawn to it as a means of being able to help our own patients. So I was able to, pre-COVID, complete the training session. And while you're getting trained, you can decide and learn more about a particular area. And I was always just smoking cessation. Part of it has to do, I would say a lot of it has to do with the fact that my mother was a smoker. My mother had COPD, emphysema, and ultimately that is what ended her life. And so I always thought to myself, oh boy, if you can get somebody to stop smoking, it is across the board such a benefit, particularly to the person themselves and their health. Also for their need to take medicines, for the strain on the healthcare system, for the workforce, that there's everything about, being able to stop smoking that just seems like would be so great for patients who wanted to do it if they could stop smoking. And so I decided that would be an area I would concentrate on. Now, I have to tell you, COVID got in the way a bit. So that and my other advanced duties as becoming the supervisor and the coordinator of the program. So I have my training. I've had some practice, and I hope to bring that into family medicine at Greenhill relatively soon. When I get my full complement of staff, I'm going to take a little bit of a refresher course and I'm going to be right back in it. I already have patients on a waiting list that want this. And hypnotherapy for smoking cessation is extremely effective. I was shocked. This is why I picked it too, because if someone is motivated to stop smoking, they can do it through hypnotherapy. So that is where my heart in part lies, and we'll get to soon, I hope.
You will. You will. And I definitely have clients that I can refer as well that really could use this type of therapy to help them stop smoking. But one of the things about the COVID pandemic is we have all tried to find ways and hobbies to cope with such all of these uncertain times that we're living in right now. And I'm a violinist, but you're a vocalist. And you sing at your home church, Resurrection Parish Catholic Church. Can you talk about that? Because I'm sure that has also been healing to your church community and for yourself as well.
Yeah, sure. I'd love to speak about it. So we all know that with the COVID pandemic, a lot of the church services couldn't happen because of, the mandates of not gathering large groups of people. So our church, for until recently, and we may go back to it again now, but we would record the service ahead of time that would air on YouTube on Sundays. So we would get together and we would be standing very far apart in our church, and our priest would come and we would actually do a mass, and then it would be recorded and then played on Sunday. And I had to say at first, I was like, well, I mean, how is that really like going to church? Nobody's in the church. We're standing there doing our thing. But it ended up being a very moving and unique experience. Very small. There were only like 4 people. The people, the priest, the vocalist, the guitarist, and the person with the camera. But it ended up being such a very beautiful experience. I was surprised at, so I was so happy to be a part of that. And then we were able to show that to our parishioners. They could check in on Sunday, and we got so much feedback about just feeling so good to be able to partake in a service again. So, I'm very thankful, always have been very thankful to God for the ability to sing. And, I was told by the nuns when I was young, singing was praying twice. So I was like, good, get it in, get extra points in there by singing and as praying. But it is singing as praying. And it's been wonderfully healing and comforting, I want to say, to me and hopefully to the other people in our parish as well.
Wow.
So about that.
Well, I have to come to one of your concerts, so I'm going to put that on my bucket list. I want to hear you sing. I won't have you do it right now on TOVA Tuesday, but I'm sure.
Yes, and we're not going to be doing anything soon in the public, my partner and I, because of COVID again. But when things clear up, I will let you know.
So, Nurse Wendy, I also wanted to share with the viewing audience, as a care coordinator, I don't think people see all of the behind the scenes work that happens during a visit and why it's important to have a nurse on your team. So not only do you triage sick calls, nurses in the care coordination program do a lot of paperwork, making sure your clients get durable medical equipment. If they need work notes, prescription appeals, you help your clients develop personalized care plans, and you also assist with referrals. But I am missing a lot more. But why should we value a nurse in the primary care setting?
Oh, well, I will say that we should value every person in the care setting. But since we're just talking about nurses today, we can focus on that. Well, I will tell you, the owner of family medicine at Greenhill, Dr. James Gill, he felt very passionate about instituting chronic care management back in 2015 when Medicare, they were the first ones, and we thank them for that recognized the benefit of having behind the scenes care coordination for patients. And so we have been doing it since then, first with Medicare patients and then other insurers as they do reimbursement. And it's really important because it establishes a relationship, number one, to me, between a nurse and a patient. Those patients have someone to call, to pick up the phone and talk to or get a call back from. Okay, so you have that personal relationship. And yes, it doesn't supersede the physician or the nurse practitioner relationship, but you're not going to be able to pick up the phone and talk to your clinician because they're busy seeing patients. So the nurse is kind of like that frontline first contact. And so we have, and I'm part of a big team of people now. I'm not the only nurse. I'm the nursing supervisor. We have multiple nurses, we have multiple medical assistants all working together. But the patients have just thanked us time and time again for being there for them, to discuss their concerns, to bring their questions to their clinicians, because we kind of act as the mediator between the patient and the clinician. If the patient has concerns or questions, We take the information, we bring it back to the clinician, and then we can get back to the patient or schedule them to see the clinician, either come in or telemedicine, depending on that. So I see that relationship, that touch point, as really critical. And because of that, I think it leads to just overall better care for the patient. We focus not only when patients call us when they're not feeling well, but we also try to focus on their preventive measures, getting the things done that were ordered at their appointments, their labs, their mammograms, their cancer screening things. And we just think it results in overall better care for the patient. Yes, does it save the healthcare system money to keep people out of the hospital? Sure. And, we suspect this is why insurance companies like it, because they want to keep their bills down. But honestly, we like it because we want to keep patients out of the hospital too, because we want to keep patients out of the hospital. Was not a great place before unless you need it. And certainly not now during COVID. So we really try to keep patients out of the emergency room if they call and they have a concern and it's not crushing chest pain or bleeding all over the place. If it doesn't seem like it's critical, we can tell the patients, get in your car, come to our door, we will see you now. And we do it, and we do that. Our clinicians stand behind that, because 9 times out of 10, a patient doesn't need to go to the emergency room. And so we can avert that. But if they do need to go to the emergency room, I always tell the patients, it's kind of like a little bit of a joke, but if they come to our office and they need to go to the emergency room, they get the Disney Fast Pass and they get a call to the emergency room and they get right in. So how can that not be better than going to the emergency room and sitting for 12 hours, kind of thing. So we really try to do that. And it's in part our office policies and in part because of the nursing staff that are there to care for the patient, to answer their questions, to help them get their tests done, and help them with the barriers that undoubtedly, all of us, besides being in healthcare ourselves, we're likely patients somewhere. And I know I've experienced my own personal barriers, to getting the sleep study done or getting the durable equipment for my in-laws and things like that. So there just are those things that, they can use the helping hand of a nurse and the CCM team. So I'm really proud to be a part of it, and I really love it, and such a dedicated staff. I'm not sure if I fully answered your question, but I did talk.
Oh, yeah. And I also want to say, for the sickle cell community and our clients, that you have, embraced them under your umbrella and they get just such high quality care. And I'm just so grateful to have your expertise and Dr. Gill's and all of the providers in the practice. But one of the things you do too is, for our seniors, you help to put together all of their paperwork and making sure they meet their quality indicator points for their Medicare wellness exams. And why is that also so important for seniors as well?
Right. So
not just seniors, but other patients that are on Medicare as well.
For everyone. So really all of your TOVA patients, I imagine you have a broad stroke of age ranges.
Yeah.
And so that annual, and I'll tell you, your patients probably get these calls, Dr. Anderson, to come in for their Medicare wellness or their annual preventive. And both of them are really important because it's not just listening to the lungs and the heart. The core of these appointments are to go over preventive measures because there's been a lot of research done about what things are important at what age, and everything that we recommend for our patients has the backup of the United States Preventive Task Force. So we know by age what are the preventive measures or the screening tests that should be done, really, because I think most people know this now, but colon cancer is so preventable, if not preventable, but treatable if caught early. And this is why we really need people to get colon cancer screening. Same thing with breast cancer. Same thing with lung cancer if a patient has a history of smoking, past or present. The lungs, the low-dose CT CAT scan now. They're just are indicators that we know now that if we can drill into and get that information, have the patient get the tests, that we can really help them be healthier, live longer lives, avoid some of the things that were not possible in the past. We're lucky that we have the knowledge that we do now for the preventive measures. So coming in for that Medicare wellness visit, it's something I'll tell you that Medicare is very, very adamant that they want their patients to have. And we as clinicians are adamant we want patients to have for the good of the patient's health. Same thing with the annual physical or preventive exam, however you want to call it. So that is our goal. And can I just mention one other thing for your TOVA patients as well, because I know that they, face unique health conditions and circumstances. Post-hospitalization, it is critical to touch base with your clinician, your primary care clinician, with either via telemedicine or an in-office visit. And as you can imagine, medication sometimes gets changed in the hospital, and we don't always know it. Sometimes there's a doubling of medications or, just things that don't go well together. So having that is critical for all patients, I would think, particularly the sickle cell population, to have that as well. It just leads to, better care and decreased rehospitalizations. Nobody wants to go back. And they found that the strongest indicator to prevent that from happening is having the post-hospitalization visit with your clinician. So that's a shameless plug, but it's really, really important, and research backs that up.
And I also want to say that, we call our patients a lot. We stay on top of them, and we know when they're in the hospital, and we call them within those 7 days to sort of tie in those loose ends and provide that transition of care, which is very important, like you said, Nurse Wendy, to make sure that we reduce that likelihood of them being readmitted for the same issue. So, and especially with COVID right now, we really want to try to keep our clients out of the hospital if all possible.
Exactly. Yeah.
So I also wanted to just share that I know there's been some challenges in the past for reimbursing nurses for their time. And we're currently working closely to try to get more of the insurers to reimburse for nurses' time. Can you talk just quickly about where we are and why that is so important for our community to know about what is going on the legislative side?
Sure. I can just give you a kind of a broad stroke. I mentioned before that Medicare was the first insurer, I guess they are an insurer, to pay for chronic care management. So that's a federal plan. So that's everywhere in the entire country. And that was initially the only insurer that paid for chronic care management. Then Delaware Medicaid, the Medicaid's either Highmark Health Options, AmeriHealth, Carnitas, they also jumped on board and do pay. They recognize the importance of pay for chronic care management. The commercial insurances, however, have been slow to jump on that bandwagon without sounding the way this is truly going to sound. But the fact is insurances are for-profit organizations. So I sometimes think maybe they're thinking a little bit about their bottom line, although I think it's penny wise and dollar foolish. If we can care for them and keep them out of the hospital, you're saving money and patients aren't going to the hospital regardless. But I know I can say that Dr. Gill has worked with Delaware state legislation to try to mandate in commercial insurances to pay for chronic care management. And it's been somewhat successful. But not all the insurers, they find loopholes, so they're not all paying for it. But the ones that do pay for it, we're grateful. I think the patients are grateful. Hopefully it will be something that all insurers will recognize as important and great. And now it doesn't mean, and I should make a disclosure, if you have an insurance, speaking to the patients who may be watching this, that doesn't have an insurance that pays for chronic care management, it doesn't mean you're not going to be cared for at our office. You're going to be cared for 100%. Are you going to have, the TOVA population is a little bit different. And Dr. Anderson, you can speak to this if the patients would still be working with Donna regardless of that, so I don't want to say like bad if your insurance doesn't pay for it, because you're going to still get cared for anyway. But at least for the patients, if I can say the non-TOVA patients without it sounding like the way it does, the general population, if they have an insurance that doesn't pay for chronic care management, they're going to need more often to come in or have a telemedicine to talk to their clinician. But, and if there's any question about the emergency room, we will see them. The nurses will still talk to them, and anybody who has COVID, any patient, any age, any insurer, any designation, it all comes to the nurses, and we try to very well care for all the COVID patients. So there's kind of a little bit exceptions to that rule if your insurance doesn't pay for chronic care management, because I don't want anybody to think that they're not going to get very high quality care. You might not have a direct nurse navigator, but you're still going to get the service that you need from our practice.
Yeah, I want to say that too, because we have so many other types of provisions in place to have our clients talk to someone at least, and then we can navigate them to the appropriate channels to make sure that they get what they need. So we're always willing to make sure that they get access to care. And even if there is some financial difficulties, we still provide ways to which to help them meet those challenges as well, because we want to keep our community healthy. That's our goal. So we'll work with you. Exactly. This practice is very generous that way. They don't turn anyone away for financial need or financial hardship. Not at all. So, and I'm proud of that as well. Good. So I know we could talk forever and ever, Nurse Wendy, but I also want to say that we're just so grateful for your service to the community and all that you do. But if someone wants to get access to a primary care physician or a primary care provider, nurse practitioner, or doctor, Family Medicine at Greenhill is accepting patients, and TOVA Community Health is also accepting patients, specializing in those who have sickle cell anemia trait or very complicated chronic medical conditions. But how would they be able to do that?
Oh, okay. So is everyone seeing the slide that we're seeing, Dr. Anderson?
Yep. Yes.
Okay. Well, if you'd like to become a new patient, we've recently been blessed with a nurse practitioner who's relatively recent and a new physician. So we do have many of our clinicians, or at least those, back it up, several of our clinicians have openings, not all, but several do. So if you're looking for a primary care practice, this is a great practice I would recommend. The number that's on your screen, you can call, or you can go on our website, which is listed there as fmagreenhill.com. There's a new patient packet. You fill that out. You give it to the patient, you give it to the office, either send it to them online or you drop it off at our office and you'll get a call for a new patient appointment. So yes, that is the number to call, and that's our website for the new patient packet.
Thank you so much for that. And if there's any questions, you can always call the office at 302-429-5870, and someone will be able to direct you to the right place and get you what you need. So before I end, Nurse Wendy, is there anything else you would like to share with the community?
Be well, be safe, and have a happy health. Okay, sorry about that. We're here for you. We're here for our patients. I will say that our patients seem to be very pleased overall with our practice. We're not perfect, but we do the best we can.
Yes, and it is a challenge for independent providers and independent practices also to continue to provide services. And we've seen a lot close in the past couple of years, but Family Medicine at Greenhill is growing and expanding. So even with the challenges, you guys do such great work, and we're grateful for TOVA as well that we've been able to hang on even in these uncertain times. So we're willing to take you on and provide all of the care that we can to keep you healthy and well. So, Nurse Wendy, I want to thank you. Thank you so much for coming on TOVA Tuesday today.
My pleasure. Thank you for inviting me.
Great show. If you want to learn more about TOVA Health TV, please visit us on our Facebook page at TOVA Community Health or Instagram at TOVA Community Health. If you like this show, we would appreciate if you can make a donation through our Donate app, Cash App at $TOVA Health, or our PayPal link at contact@tovacommunityhealth.org. So again, I just want to thank you, Nurse Wendy, for coming on TOVA Tuesday today, and we will see you back for another episode of TOVA Tuesday.
Anytime.
Take care and have a good day.
You too.